Thank you, Tim, and good morning, good evening, and good afternoon to all. So the EU Disinfo Lab is a Brussels-based NGO working on disinformation, on all the aspects of disinformation. So we've been working on campaigns, elections, but also conspiracy theories, media literacy for the past 3 years. So of course, when the infodemic started a few weeks ago, we had the unpleasant surprise to not be surprised by what we could see. So some part of our daily activity is actually to understand what kind of disinformation is spreading within the European Union in different member states. We can go to next slide, please, Tina, where we're trying to understand what are the different narratives and tactics that are being used. So we do an analysis on the main disinformation spread. As we're not journalists, we use what fact checkers are debunking on a daily basis. And I would like to thank the very good work of AFP and all of the fact checkers to actually document and fact check these for the public opinion. And our job is actually to understand like how these narratives are repeating themselves. Do we find these narratives in different countries at the same time? We also do comparisons with global trends that we can observe with different research partners or research organizations in the field. And we also do investigations when we try to understand how different narratives are being spread. We had an investigation a few weeks ago on an African-based network that was doing disinformation around the COVID-19, and we were able to show how this network was organized around monetization of disinformation. So they were actually spreading disinformation around COVID-19 and fake news to actually get money out of it through the platforms, whether it's Facebook, whether it's Google, Twitter, or Google Ads, for instance. Then we also monitor the different platforms' responses to the COVID-19 crisis. So we had a very good example of what Facebook is doing, but we're also trying to understand like what is Instagram, WhatsApp, Snapchat, TikTok, Weibo, Telegram, all of these platforms, what are they currently implementing, and if they are actually implementing what they do. So we also check what kind of actions are done behind communications and behind announcements of platforms. And we just created a resource hub, which is available on our website, disinfo.eu/coronavirus, where we put all of this information, the WHO Mythbuster, the EU versus Disinfo, the European Commission Mythbuster together, so everybody can have a quick look at what's being done, and we update this on a daily basis. We can go to the next slide. So what did we see in the past month? We saw that there are different phases in how disinformation and narratives operate. And we could see on the first weeks of the infodemic that we had what we call the outbreak in China, where we had only a focus on the situation in China, already international conspiracy theories about the virus being created by the Gates Foundation, the virus being created by a Chinese laboratory in Wuhan. And we already saw this when the pandemic was still in China. Then when it started to go into multiple countries, we have this narrative that we entitled like the threat is getting closer. So we can see that we have already a certainty which is used to create panic. We don't know what this is. We have false cases being announced or allegedly cases being announced. Things like there are 200 cases in the country, but nobody talks about it. We also see it's less health related, but like distrust in authorities, saying that the military and the army should take over the government because the government is not doing enough, etc. And we start to see all the things about the false cure and prevention of the disease. So we don't talk here about social distancing, but we already talk about drinking water, stay in the sun, which were like the most first false truths that were advertised online. And then once it hits the country, then we can see all the local conspiracy theories going on about why the government doesn't tell you the real number of people being sick, the situation in hospitals. We can also see all the disinformation items which are playing on the existing division in European societies, whether it's political, the left is hiding things or right is hiding things. It can be social, like the elites have the right to be tested, but the poor people like us, we can't be tested and we're gonna die. It could be social in the way that we are letting the old people die, but and nobody's doing anything against that. And we also have the identity question. The migrants are not respecting this. People from different religion are not respecting curfews or social distancing, etc., etc. We also saw a politicization of the cure question. So in France, we had a major controversy, which is still going on and has grown international with the hydrochloroquine issue, where we could see that everything there was politicized. So we have had this discussion about, is it a good cure? Why, if it's such a good cure, why it's not used? Why is Big Pharma preventing us to have access to this cure? And there is a doctor saying that this cure is working, so why don't we have it? And we used to take Plaquenil and chloroquine before, so why can't we take it right now? Etc. We also saw all the messages playing on health fears or advertising false cures. So chloroquine or any kind of medicine that could help. We can go to the next slide, please. And what is very interesting with this crisis is that we see a change in the main tactics being used to spread disinformation on COVID-19. We see the heavy use of private messaging apps like WhatsApp and Messenger and Telegram to spread disinformation items. This is something that happened before in Brazil, in India, but Western Europe was not prepared to this, and it's really a new thing for Western Europe to actually deal with massive disinformation being spread on massive messaging apps like WhatsApp, Messenger, or Telegram. We also see the creation of many anonymous channels on Telegram or on Twitter, like COVID news, COVID-19 news, coronavirus live, which we don't know who's behind these. So some of them are spreading, are repeating health authorities' information, which is very good. But some of them are also spreading disinformation about doctors dying because of COVID-19, whether they were not dead at all. So we can see also we have a new economy and a new opportunity for players to go inside and to create their own news channel and to gather large audiences around this. For instance, a group on Facebook on chloroquine, on Didier Raoult protocol, has gathered more than 1 million French people in 3 weeks, which is quite amazing, the pace of how people have joined this group. And now this group is a repository of many different conspiracy theories. We also see that we have an adaptation of international disinformation items to local context and language, what we call the globalization of the fake. So we can clearly see that messages in Italian, for instance, are spread in France with people translating them. We don't know who that come from, but they say it's come from a nurse, from a doctor. And we absolutely have, like, ordinary people that don't have the language capacity, have no capacity to actually understand what's going on and what kind of information being spread. And we actually don't know if a nurse actually recorded audio messages, for instance. We also see a multiplication of decontextualized pictures and videos. Scientific debates are also used to spread disinformation items and conspiracy theories. That's something really strong around chloroquine, for instance. And we can see that we have reorientation of a full ecosystem of disinformation. Pierluigi was talking about junk sites. We are monitoring junk sites in a few European countries, and we can see how they jump on this and how they frame all of this issue into a coherent, and I'm using this word with quotation mark, with a coherent vision against the COVID-19, which is a whole part of an international conspiracy. What is very interesting is that, and that's a question I would like to ask also to epidemiologists. I think when we say disinformation is viral, I think we say this, it propagates the same as a virus. So the question is, how can we imagine that epidemiology can help us to understand how virality of information and virality of disinformation can now use new clusters, new vehicles, just as massive Facebook groups, massive WhatsApp and Telegram channels or groups, Facebook pages, Twitter accounts. And it's sometimes use existing clusters. You have the coronavirus 5G conspiracy theory. It uses already existing 5G and against 5G conspiracy groups that were already there, and this new theory is feeding this thing. So it uses already existing clusters to actually propagate and to keep people in that disinformation loop and conspiracy loop. We also see that because of how the disease goes fast and how the information goes fast, but how science is slow in having to have proof and evidence of medicine working, we have an information asymmetry that we need to address. We need to accept the fact that we don't know right now. And this is part of building what I call the herd disinformation immunity. It's like we need to build an immunity to disinformation, which is collective, which needs like a major part of the population to actually understand and be cautious about what they see online and how and what they reshare online. And that's one of the main things we have to work together on. And then we also have a huge question about the impersonation of health authorities. We have seen in France fake Twitter accounts of doctors, of nurses being set up to advocate chloroquine. And when investigators like searched into these Twitter accounts, they discovered that these people were not doctors at all, that people actually impersonating or even using names of real doctors to actually promote this kind of thing, because then they were able to create an audience and they were able to talk to a massive population. So we have many incentives around this. We also have foreign influence playing on this, whether from China, from Russia, from the White House, and from many different actors. I think the question is like how, and we can go to the next slide. I think the question is like how there is first a platform response, and I think the platforms have been very, very proactive in supporting like new ways of flagging online content about this. There are still content which is still there around 5G and coronavirus on YouTube, for instance, even 5 days after that YouTube announced that all of these videos will be removed. We still find videos with millions of views there on YouTube today, on 5G and COVID-19. There are questions about automated content moderation and how this can work. I think there are crucial needs to have more cooperation between health authorities and fact checkers, and to have access to reliable science authorities. And I think one of the questions that we see is that we will have, after this crisis, to understand how we can slow down the spread of infodemic. Because the question is now how fast we can accelerate science, because there is a limit to this. We cannot put a fast forward machine on tests for everything, but we'll have to understand that we have to slow down on how much information we share, and maybe to slow down distribution of information. And to this, we will need to have an oversight on how information is distributed online, on what are the main clusters, how many people are reached, how many people are seeing things, how many fake information is being shared online. I heard that Facebook said a little bit earlier that we had 100 million people clicking on health authoritative content on Facebook. I think this is great, but I think we should and we ought to know how many people have clicked and how many people have shared disinformation around COVID-19 in the past 3 months, and how this will evolve in the next weeks and months.